Our partnership with Access Elemental and Life Rooms, and just around about the client journey using the Access Elemental and Rio integration. So an introduction to social prescribing. I think a lot of you will already know this, but nice overview slide, but social prescribing is linking individuals with non-clinical activities in their community. So using the Elemental system, we most see that referrals are made into social prescribing projects from mental health clinicians, you have practice nurses, you have GPs, and then you have the likes of OTs, you have police officers, all making referrals into social prescribing projects. So you can see at the right-hand side, we have some stats, so good stats there. So 1/3 of the referrals to social prescribing are because of mental health concerns. So without social prescribing, if the patient is attending an appointment and there's maybe something wrong with their mental health, they take medication and maybe the time passes and the symptoms are appearing again and they're reverting back to another appointment. Putting social prescribing in place, it's giving the client, the tools to sustain their health and well-being. They're having that one-to-one handhold support by the link worker to maybe attend the men's shed. Maybe they're quite nervous and they don't want to go to the service. So maybe it's that bit of handholding to go along with the person and get them to build their courage up. So a bit around the Access Elemental platform. So we're a cloud-based platform. We've all our config options at the bottom, but basically an overview is it enables users to make, manage and report and referrals and do social prescribing projects. So it's responsive, it's configurable, and each project is so different. So we have loads of config options. It's interoperable, which is what we're going to talk about today. It's accessible and it's scalable. We have 4 modules. The ones that we'll focus on is the case management system and the Connector Plus module. And I suppose just a brief overview is why the case management system was created was basically that health and wellbeing teams didn't have any way to, report on the amount of admin they were doing with clients. There was no way to safely receive referrals. They were working with paper systems, different systems, but none of them were working for them. And then for all the great work that everyone was doing, there was no reporting functionality behind that. Again, a brief overview, it's highly configurable. We co-design it with the projects that we have, and me and Georgie has been on loads of co-design journeys together to make the Elemental system fit for purpose for their project. And then it's supporting all the activity that the Life Rooms projects does on a day-to-day basis so they can report on that. So Connector Plus is where the Access Elemental and Rio integration comes in. It falls under the Connector Plus module because why it was created simply was that there was no safe and efficient way to make referrals, and they were using different types of referral forms. They had to go find them. They were sent on email, and then what would happen is once a referral form was sent, there was no way for anyone to track. We've sent this person on to a mental health service that the community-based organisation is offering. How are they getting on? Have they attended the service? Has their health and well-being increased? So the platform and the integration allows the users to track all that information. So again, we're not just integrated with Rio, we have the third-party interoperability, so we have links in with EMIS, Envision and System 1. But an overview of it, and I have a nice video to show you all, just to show you the Rio integration, the problem, basically what I just said there now, but there was no safe and secure way to make referrals. There was no trustworthy directory of service, so they weren't referring and they weren't sure if the services were quality approved, and then the clinicians were spending too much time on finding referral forms. So the desired outcomes, we want to save clinicians time, reduce the amount of time that they're spending on addressing the social needs, making sure the referrals are safe and efficient, and then obviously having access to the client notes then after. So I know I've referred on to that service and they've attended the service, they've had initial conversations, and their health and wellbeing is tracked by using maybe SWEMWebs or ONS. So looks a bit like this. It's a click-through. The user doesn't have to leave their native system, so they open within their favourites tab up there at the right-hand side, and there's an Elemental button. So what happens when you click on that, and I'll show you in the video, but there's a new Express referral button, and rather than someone writing out all the information, it's all pre-populated for the user. It's 4 clicks basically to send your referral into a social prescribing project. And then after that, if the patient or citizen, does come back around and you're having another appointment with them, you can click onto Elemental and see basically, how many visits they've had, have they attended their appointments, have they went to the local men's shed, and that can all be tracked through Elemental and Rio integration. So I have a lovely video, and I'll be quiet for a while.
In today's fast-paced world, mental health clinicians face the challenges of meeting not only the clinical needs of their patients, but also their social needs. This can be overwhelming, leaving clinicians with less time to focus on what they do best, addressing the clinical needs of their patients. Meet Sarah, a mental health clinician who understands the importance of providing comprehensive care to her patients. However, she encounters obstacles in connecting her patients to social interventions in the community. Sarah spends up to 2 hours every day trying to meet the social needs of her patients instead of focusing her time on her patients' clinical needs. This is where the Rio Elemental integration comes in. It's our comprehensive solution designed to streamline the process and empower mental health clinicians like Sarah. These top features of the Rio Elemental integration make it a game changer for mental health clinicians like Sarah. View the local services that have been prescribed by the social prescriber allows the clinician to get to know what services are in the area. See what interventions are having the biggest positive impact on a specific cohort of patients. The link worker can communicate with the Rio clinician. This keeps the clinician up to date with the patient's health and well-being progress in a more qualitative manner. Referrals are pre-populated with the client's data, reducing the admin time to make a referral. A digital referral pathway for patients in Rio to be referred to social prescribing. On the Rio platform, Sarah can utilise the Elemental integration to easily access patient profiles. Pre-populated patient information makes referrals to social prescribing projects outside of a clinical setting super easy, helping the patients to increase their mental health and well-being through attending community-based services. Sarah can check back in and track progress and scores from various health and well-being monitoring tools, allowing her to keep up to date with the patient's progress in a more qualitative manner. At any time during the referral to social prescribing, the link worker can send notes back to Sarah, updating her on any relevant information. Sarah is also able to see what her patient is attending and how many attendances. Sarah says, "The Rio Elemental integration has transformed my workflow. I can now focus on delivering the best clinical care for my patients while knowing that their social needs are being addressed." With the Rio Elemental integration, Sarah and her team have been able to achieve their goals of providing comprehensive care and improving patient outcomes. The Rio Elemental integration gives care organisations a software solution that streamlines processes, enhances communication, and enables them to deliver exceptional care. Discover the power of the Rio Elemental integration today and revolutionise the way you provide care.
So just to introduce Georgina around the Access Elemental and Lifeframes partnership. So we've been working really closely together since 2017 when there was a mutual conversation, and they went live with our case management module in 2018. So from 2018 to 2019, they received over 1,000 new referrals under their service. And then in 2020, during COVID, they went live with one of the self-refer modules. But the one that we're here to focus on today is the Rio Elemental integration, which went live in 2022. And I suppose a big shout out to Lifeframes. They've just been awarded the Innovation in Community Mental Health Awards for the integration and highly commended in quality improvement service transformation. So these are the types of teams that are referring in using the Rio integration. So you have recovery teams, long COVID teams, the CMHT team, and they're referring into the pathways advisors in the Lifeframes project. So they're having the initial conversations, they're co-creating the social prescription package. And then Lifeframes is a very special project because they also do the social prescription side of it. So they provide the employment support, they do the volunteering, and provide the housing support as well. A bit around the client's journey. So the referral is made using the Rio and Elemental integration. The pathways advisor receives the referral, so it's going through the Elemental Rio integration into the Elemental case management system, and they're picking up and managing that referral. So they're recording all their appointments, their visits, their conversations, sending text messages all through the Elemental case management system. They're having the conversations, and they're having the conversations around what matters most to the client, and then they're co-creating the social prescription package. So although someone may have been referred for mental health, they're getting to the root cause of the problem along with the pathways advisor. So it might have been mental health initially, but when you get down to it, it might have been maybe they needed some debt advice, maybe there's different issues going on at home, and that can be all identified through the conversations that they're having with the pathways advisor. So step 5 then is further contact. So you have, they can get follow-up support, more of that one-to-one, that bit of hand-holding that they may need, and they're taking their wellbeing scores. So they show that their health and wellbeing has improved. Projects will use things like swim webs and ONS to show that, from attending these services, the client's wellbeing has improved. And then step 6 for the client, their health risk is reduced, they're feeling less anxious, and they're attending more services. And then step 7 is your results then. So they're more engaged, they're activated, and then you're able to report and, I suppose, get more funding for these services.
So hi everyone, my name's Georgie. We operate under what we call a social model of health. So we have an element of social prescribing, learning and community inclusion. So we don't just do social prescribing. A big part of our offer is an internal offer. And within that, we do some work around health activation, digital empowerment, and we give practical support and we create learning opportunities for the people who use our services. Mersey Care is the first NHS trust in the UK to have this interoperability between Rio and Elemental. So what we were finding was that a lot of the clinicians who were referring to our services were actually doing so through a web page. So pretty basic, again, loads of spreadsheets, a lot of room for error. So people were going for support around their housing, their finances, their employment support, and actually that is not how clinical time is best spent. We have that resource and we can pick that up. So we wanted a really seamless pathway for our clinicians to not kind of overburden them or to add an additional administrative task to them. We wanted to be able to refer really easily, 4 clicks, and we can pick it all up. We originally started this project, which we called the Mid-Mersey Interoperability Project, and we expanded our footprint. And more recently, we've been able to roll this out across kind of Liverpool as well. We conducted a very thorough evaluation, so shameless plug, you can read that online. But it was a very comprehensive evaluation because we really wanted to be able to kind of demonstrate the value of our service. So a lot of people sometimes say social prescribing is a bit fluffy and you might do a bit of ukuleles or a bit here, that, anything like that. But actually we wanted to really demonstrate the value of our services. So we conducted an evaluation which looked at activity data, so referrals, drop-ins, registrations, appointments, social prescriptions, and then we also were able to look at a bit of an audit data, who was using the service and how is it being used. So is it particular demographics, particular cohorts, how often are people using the service, and we were able to build all of that in using the information that was fed through from Rio into Elemental. We then had a qualitative side because we wanted to understand actually the impact and the experience. So the tech is all well and good, but what was the benefit for the end person? So we had some questionnaires, case studies, and focus groups. And we did that with both our service users, but also clinicians as well, because it was really important for us to understand the benefits for both. So throughout the course of the project, we had 1,396 referrals from our Mid-Mersey clinical teams. We then had 1,608 registrations. So because we were able to expand our services, some people did just drop in too. And that generated 2,054 social prescriptions. Now, the interesting insight that we were able to get from this was, well, what kind of things are people wanting support on? So we were able to look at the top reasons for referral, and that was mostly around mental health and wellbeing in general, but then also finances, benefits and debt advice, as well as social interaction. So on the back of COVID, people were isolated and actually they just wanted to be able to connect to their communities. So what we were able to do through the Rio integration was a clinician, doesn't have that opportunity to be out in the community as much with such a caseload, whereas our pathways advisors are those community assets. They understand what happens in the communities, where different people can benefit from. Being able to track it through, we can see, what support people need, and then how can we use that to inform our service? So what other kind of scoping do we need to do? What other partners, VCSE organisations do we need to include? We did 36 surveys with some of our referring clinicians. So we had 94.5% of clinicians who felt satisfied with our service. 91% indicated that they would experience a negative impact on their clinical practice if they could no longer refer into the life rooms. 94% of our clinicians felt confident or assured that when referring into our services, they would receive high quality care. Obviously, being part of the NHS, we're able to quality assure all of our partners. We did a bit of a base measure in terms of how long did you spend before and how long did you spend after the interoperability in meeting those social needs of your patients. Some clinicians initially said it was, up to 2 hours filling out forms, giving advice, doing a bit of scoping around what community assets could be offered to people. And actually all of our staff have that's their expertise. So some qualitative findings from our clinicians: I saved at least 3 hours on average for each patient, logging onto systems with them, making calls, printing off maps, explaining what a service does. And that doesn't actually include the clinician looking for the services on offer, so you're already relying on a bit of knowledge of your community there. And one clinician said, it allows me more time to spend with my patients actually carrying out therapy, but in the knowledge that their needs like finances and their social life are being considered too. So it really does allow for that kind of holistic pathway of support and not just the medical model. We also did a lot of evaluation with our service users, so it's really important to make sure that that transition, whilst it seemed very seamless for us and the clinicians, was that the same for the end user. 97% of service users that we surveyed said that accessing the life room service was easy for them. 100% of service users agreed it was easy to discuss their concerns. And 87% said that the life rooms provided all of the support that they were looking for. So all of that time that maybe they might have spent with their GP, they could actually come and speak to our staff about it, and they could point them in the right direction. We had a look at well-being, so obviously we want to be able to kind of quantify this in some way. So we did have 92.6% of service users who said that the support they received has a positive effect on their mental well-being. Some service users said, I found it really helpful getting my thoughts and feelings out and understanding what anxiety really is and how it can impact you. I was able to talk about what help I needed and open up. It's really helped me gain confidence and knowledge. It also talks about kind of accessing other areas of our offer, so not just social prescribing, but some of those learning courses that we have too. Some reflections that we had across the project was that initially we actually kind of started all of this work based on the COVID pandemic, so kind of supporting communities to get back onto their feet after COVID. However, it became very apparent very quickly that actually it's the cost of living coupled with the COVID consequences that's why people are seeking out a lot of support, and there needs to be kind of a system-wide approach to dealing with that.